Oh, perfect. Great. Well, thank you all for being here today. We're excited to share about the 2026 point in time count. My name is Eliza Wilson. I currently serve as the chair of the Homeless Leadership Coalition Board. We're the region's continuum of care. I don't know if Autumn, if you can.
Yeah, hi, I'm Autumn Camreta. I am the Director of Housing and Homeless Services at Neighbor Impact, and Neighbor Impact currently serves as the HMIS lead for the continuum of care.
Great. The point in time count, also known as the PIT, is a HUD mandated nationwide survey of people experiencing homelessness across the country. HUD mandates that we do this count in January. And really, the purpose is to help communities collect data regarding counts of folks experiencing homelessness, their demographics, potential causes of homelessness in areas, and how individuals are or are not accessing available resources. The pig count is organized and conducted by the HLC every year, but really it's the work of all of our service provider partners and community agencies, as well as Neighbor Impact and COIC as our collaborative applicant that do all the work. And we just have to thank them every year for all the work that they do, putting in all of the hours to make sure that we can get these surveys done across the region. HUD only mandates a full count every other year. Every year, a sheltered count is required. But we at the Homeless Leadership Coalition, our members have decided to conduct a full count annually to really help us get a full picture of those both sheltered and unsheltered every year. Go to the next slide.
So the methodology that we used this year was the Counting Us app. And so all of the counts for sheltered and unsheltered and observation tallies went into this app. The surveys were conducted between January 27th and February 2nd for where folks were on the night of January 26th. From those data, we found that there were 1,467 electronic interviews completed, 177 observational surveys, and 570 were in shelters across the region. So that total brings us to 1,706 unique unduplicated people in this 2026 point in time count. The surveys were conducted across the region, in Warm Springs down to Lapine, from Sisters to Prineville. And one thing that we do want to note that was particularly interesting this year is there were an additional 13 individuals that were collected in the count that are not included in the 1,706 because they were outside of our continuum of care. However, from where they were located, they would be reasonably accessing services within our CoC. And this information was passed along to us by outreach workers who interviewed those folks. Next slide.
The PIT really provides a snapshot in time of conditions in our local community. It identifies differing needs across Central Oregon. I think this is particularly important given that our cities and jurisdictions are so different. The funding that comes to them is different, and the size is different. As Autumn said in the previous slide, we've been hearing a lot in Lapine that we have folks that are residing in Klamath County, but are really closer to that Deschutes County line that are seeking services. And sure enough, we saw that show up in the point in time count this year. I think that's due to, we've gotten better at mapping where folks are residing and where folks are doing the survey. And there's been a lot of work behind that. The PIT really provides information about our neighbors experiencing homelessness and allows us to revisit services and evaluate whether or not we're meeting local need. It helps to make quantified assumptions regarding the occurrences of homelessness in Central Oregon and helps us to advocate for additional financial resources locally at the state level and federal level. Next slide.
So, who is considered homeless? And that depends on who you ask. We have folks like in schools and healthcare and other programs that use a broader definition of precariously housed, couch surfing, doubling up, folks who are at risk of homelessness, or folks who are living in a motel paying for it on their own. For this count, we do have to follow what HUD defines as literally homeless, and that means those who are sheltered, living in an emergency shelter, transitional housing, or hotel motel paid for by a voucher or an agency, and those who are unsheltered, meaning living in areas that are not meant for human habitation, abandoned buildings, outside cars, tents, that sort of thing. Next slide.
In 2026, the 7 most common reasons folks stated as causing their homelessness were health, legal reasons, substance abuse, domestic violence, eviction, personal reasons, but really by far and large, most people who answered this question listed economic reasons for the reason that they were experiencing homelessness. This is not something that is really surprising to us. We see this time and time again with clients in real time, but also in the PIT count as, economically, like folks are really just struggling to be able to afford to live in houses. And that's why oftentimes throughout the year, we're seeing so many people enter homelessness. That's often a contributing factor, even when one of these other factors are in play, such as substance abuse. Economic or financial reasons are always, the first reason that folks are experiencing homelessness. Next slide. Oh, you're muted.
Sorry about that. This slide is showing you how the households are identifying when they are responding to the survey. And as you can see, the large majority of respondents are single adults, meaning not attached to a household. This year, we're seeing 0% responded as a child-only household, and that would be for folks who are under the age of 18. And youth at 5%, that is the age range of 18 to 24 years old. So we just wanted to kind of clarify what children only versus youth means.
I want to just call out on this slide that we know that across the country, youth and unaccompanied minors are often undercounted. And I really believe by looking at this slide and seeing, we know that it's harder to capture those numbers, even though we do have a great partner in the region with JBRJ that really does a lot of work around this. And then also the fan advocates do a lot of work around counting these folks. But to really get a true picture of youth throughout the year that are experiencing homelessness, often looking at that like McKinney-Vento numbers that the school district comes out with, and McKinney-Vento folks come out with, and then the PIT data to kind of get a better picture. Those, HUD does have a different definition, as Autumn said, as the McKinney-Vento definition, just because youth homelessness really does look different than other forms of homelessness. Next slide. We're really excited to share that in 2026, the number of unsheltered individuals in the region decreased by 306. Currently, we are still seeing that most of our unhoused neighbors are in Deschutes County. That again is not super surprising, given that the greater population in Deschutes County versus our other smaller counties. But yeah, we are seeing a decrease this year. Next slide.
And here we're just showing you the difference between sheltered and unsheltered count compared to 2025 by county. So you'll see that the drop in unsheltered from Deschutes County from 1,039 to 864. So while still high, it also has decreased.
And in this graph, this is showing the number of individuals experiencing homelessness by city. The number or the graph in orange is this year, and then last year is in blue. And I know for folks who might be feverishly writing stuff down, we will have these slides on our website, so don't worry, they're going to be put on there today or tomorrow. Next slide.
This graph is just showing you the difference between sheltered and unsheltered and by age. And something that we wanted to call out was that 187 people under the age of 25 were indicating they were unsheltered, or we observed they were unsheltered on January 26th of this year. And 227 people over the age of 55 were unsheltered.
Next slide. We hear, the misconception quite often that those experiencing homelessness are new or just passing through Central Oregon. And we see this, kind of question year over year. And in the pit, we consistently see that is just not the case. This year, respondents, 50% of respondents in Central Oregon indicated they had resided in the area for over 10 years. And as you can see, 18% for under 1 year. And so really the vast majority of folks were experiencing homelessness, became homeless in Central Oregon, and have been here for a long period of time.
Something else that we wanted to capture was the length of time people have stated that they have been experiencing homelessness. And 65% of the unhoused community have experienced homelessness for a year or longer. Next slide.
22% of the survey takers are experiencing chronic homelessness. This is a definition that HUD defines as folks who are experiencing homelessness or have had several occurrences of homelessness over the past 3 years, and also report as having a disability. It's important to note that in Central Oregon, the chronically homeless population has likely aged into chronicity, which means that they experience homelessness, as in the slide before, you could see the length of time. Folks go into homelessness and they don't access resources right away. And over time, their situation just gets worse. Medical issues get worse, and they're likely just aging into chronicity. And as situations, get more dire. Next slide.
One of the things that is important for our community to get information on is how many folks might be experiencing mental health or substance use disorders. And keeping in mind, these are self-reported. 349 individuals responded that they struggle with substance use, mental health disorders, or both. And this chart is showing you how many of those, of the 349, indicated one, the other, or both. Next slide.
Last year in 2025, the total number of folks experiencing homelessness in Central Oregon reached its inflection point. We saw the greatest number of people that year than any year before it. And it's really important to note that oftentimes it takes time for resources in a community to work, for us to house more people than folks coming into the system. And so over the last couple of years, the state of Oregon has invested a lot of money in Central Oregon around housing readiness, and prior to this year, prevention services. And we really believe, and Autumn will talk about this in the next slide, but we really believe this is why we reached that inflection point and are seeing a downward decline in the number of folks experiencing homelessness. It's also when explaining how this works, it's important to note that throughout the year, there are folks entering homelessness and folks exiting homelessness. And so when we're looking at the numbers of the point in time count year after year, this is a snapshot of during this time, this is how many folks we were able to survey. And we are able to now show a broader data set and help folks understand that this is, day after, it's every day it's a little different. And folks are accessing resources when they are available. People are trying to get housed when there's housing available, and that the resources are working.
So with that significant drop in our count, what we really thought about was what was at play to help us lower that count in our region. And one thing that we wanted to note was because of the programs that we had for rapid rehousing and the old mill and Cleveland Commons for permanent supportive housing, these projects between 2025 and 2026 took in 293 individuals. So we can easily say that 2/3 of that overall drop played some role in, or these programs played some role in that drop. So that has led to a 19% decrease. It's helped lead to the 19% decrease in homelessness in our region. So again, this chart is capturing those housed between the pit count of 2025, the night of that pit, and the pit count of this year in 2026. Next slide.
Really just a takeaway overall from this count this year is seeing the 19.1% decrease and these populations and what we're seeing as every year we show the adult number overall, adults with children total, the total number, and then veterans and unaccompanied youth. And it's important to see that these numbers are decreasing over time and that us as a community prioritizing these individuals like unaccompanied youth, families, and that it's working, veteran services, that it's working to make a difference. Next slide.
So how do we get better data? We want to let the folks know that there is a public-facing dashboard that will be released in July of 2026 to show the inflow and outflow of folks who are entering the homeless system, as well as exiting and where they might be exiting to, be that permanent housing, temporary housing options. So that will be coming. And then also working on a data quality improvement plan, which if you are a provider in Central Oregon, you have likely seen a memo and spoken to our HMIS team to improve that data quality that's being entered into our HMIS system. So that looks like working with individual programs to improve their data quality, finding what's working, what's not working, and then also having some financial accountability with HMIS use and quality. So ensuring that the funds that are being put into the system are accurately captured by way of HMIS use. So getting those tangible counts of folks who are engaging in programs that have this financial backing to it. So more to come on that, but do look out for that public-facing dashboard in 2020 or in July of 26. Next slide.
To maintain the reduction of folks experiencing homelessness and continue to reduce the numbers over time, we know that we need to continue to close those gaps that exist in our continuum around services. We need to urge the state to reinvest in prevention services, which recently decreased in the last biennium, which we will believe across the state will increase the unhoused population. We need to look at developing additional navigation centers across the region and just, calling out specifically for special populations like youth and in parts of the region that are under-resourced. We need to continue to bring more housing options online all along the spectrum of housing need, from permanent supportive housing to workforce housing, homeownership opportunities. We know, and I know that the jurisdictions are doing a lot of work around this. So if we have our folks on the line from the cities and county, thank you for all of your advocacy around this. The state has aspirational goals for us in Central Oregon and across the state to develop more housing and to bring on more housing option for folks, and we're really working together to do this in this region. And we just know that this is what's going to impact future numbers and folks who are experiencing homelessness and being able to access the resources they need to get back into housing. Next slide.
So anyone can help in our community, and that looks like getting involved. So connecting with local service providers and spreading the word about regional efforts to end homelessness, and help us advocate for state and federal funding for this particular need. I apologize for the leaving off mid-sentence in that middle block. And then also continued investment for housing and homeless services. So those are a few ways that you can get involved. Again, if you're a service provider, getting involved by way of data quality and connection with folks. Our community of service providers are wonderful, and this work would not be captured without them. Next slide.
All right, now is the time for questions. We do have a little bit of time, so if folks have specific questions, do we have anything in the chat, Rosie?
Yes. So Alex from the Youth Action Board asked, does the categorization of sheltered versus unsheltered affect which resources they are able to access?
No, that's a good question. That's just when we're doing the count, we identify like the count is done differently for folks who are in shelter, the service providers who shelter folks, collect those surveys and put that data in. And then for the folks that are experiencing unsheltered homelessness, we have service providers that go out into the field. So oftentimes outreach providers or public health, different folks that go out into the field and do those surveys. So those are just the two buckets of folks that are experiencing homelessness.
And then we have a raised hand from Central Oregon Health Council, I believe. So I'm going to go ahead and allow that real quick. Oh, before I do that, I'm going to go ahead and ask the question that in the Q&A just popped up. Sorry. Donna Burklow, it looked like an over 200 increase in evictions. What do you know about ongoing trends in this area?
Yeah, Autumn, do you guys have any updates on that? So that's going to be a hard one because I'm sure there are more and more evictions, but Neighbor Impact was cut, like their prevention funding to support folks who were evicted was just cut in this last biennium in Salem, which is across the state. That's the case. So I don't know if you guys probably have a lot of folks reaching out, Autumn, not any money to help them.
We do, and we are just, we're in the middle of closing down our application because we are out of funding for this fiscal year, more anticipated in July, of course, but that's obviously a month and a half gap for folks. So definitely serving as many folks as we can, though we do know, and we do prioritize folks who are in the eviction process. But we do know that evictions have certainly increased since the decrease in prevention funding, as well as coming out of COVID era funding and eviction moratoria.
And at the state level, the eviction prevention was cut, but so was the mortgage assistance or foreclosure assistance was also cut by more than 90 something percent. So I think that if you're interacting with our legislators, being sure to bring that up as something we know works to prevent folks from becoming homeless.
And then Alex also asked, is the survey anonymous?
No, the survey is not anonymous unless the person chooses not to answer certain questions. However, when outreach providers are out in the field trying to capture surveys, sometimes folks decline taking the survey. And so at that point, we would do a different type of survey where we try to identify, like, we don't ask the person questions, but we try to identify like where they're camping, their approximate age, information we might know about them, and demographic information so that we can still count them.
Okay, I'm going to go ahead and allow Central Oregon Health Council to ask their question.
I think you can come off mute.
Hi, I'm not sure. This is Jenny McKee from the Unitarian Church. Can you hear me?
Oh, yeah.
Okay, so we're from the Unitarian Church, not COIC. Couple of questions. Will there be further breakdowns by gender and race available that we've seen in prior years in the presentation?
You want to take that one, Eliza?
Yeah.
We do have some of that information, yes. For this broader presentation, we opted to leave that out for some internal reasons. But as the HLC decides, we can certainly make that information available.
Yeah, the team at CoIC is going to also make some community specific, so county or city specific data sheets for you guys, so you'll be able to get that information. Right now, we have to be careful about what we provide to the community as far as gender and some other race demographics, because of how it's impacting communities around funding at the federal level. We do have that data though, and can absolutely share it.
I have an additional question from Alex from the Youth Action Board. She says, does this data follow them with other service providers? I feel like that is deterring the minors and youth from being represented.
That's a good question. I think the reason that youth and minors are underrepresented, well, minors, if they're they're not attached to a family unit, it's just fear of, being put in the foster care system or getting in trouble. And then it really does have to do with what service providers they're connected to. Absolutely. So if somebody is experiencing homelessness or camping in their vehicle or, camping away from most other people and they're not connected with the service provider or very visible in the community, they may get missed in the count. That's why we call it a snapshot. It really doesn't, it's not a longer term picture of data, which is why we're really excited to have the dashboard come online. When trying to explain to folks about the inflow and outflow of folks experiencing homelessness in our region, when you look at the dashboard data, for example, it'll show many more people that entered the system, but then left, because as Autumn shared, we had, under 300 people housed in those provider services that we provided in the community for housing, like Old Mill and Cleveland Commons. And there were over 1,000 more than that either self-resolved, were able to, get a room for rent. So in the dashboard, you'll be able to see that, a more accurate picture of folks who are exiting.
And then we have another question in the Q&A from an anonymous attendee. Is there data related to counts within city limits versus outside city limits?
That's a great question. When I export the data from Counting Us, it generally gives us locations of where the data was entered. Some of our volunteers will take the information in and then enter it at a different location, such as an office. And so that can be a little messy, I think. And then also it does by zip code as well. So we can see from some of those zip codes now if it's outskirts in Crook County or outskirts in Deschutes County. Counting Us does provide a map, but it also provides, we would have to do a screenshot because it also, when you hover over the dots on the map, it gives the survey information. And so because not all of the surveys are anonymous, we want to protect and be mindful of people's privacy. So that is something that we could absolutely, if the HLC and CoIC would like to have that put on their website, we can certainly get a screenshot or a screen grab of that to just show where the differences between city limits and outside city limits.
And then we have two more questions, three. Is information collected for those who have been incarcerated and also for sex offenses? There's somewhat of a follow-up question that's like clarifying, so I'll read that one. In other words, do we know numbers for people who are homeless because they were previously incarcerated?
No, we do not capture that data. And as far as the sex offense one, no, I do know though that when people are experiencing homelessness, if they have that type of charge, it is much more difficult for them to maintain in a positive, because they have to have an address, they have to register an address. And so that can be particularly difficult for folks to do if they don't have an address to reside at. I do know, for example, in Deschutes County, they do a lot of work around that to try to find folks like regular addresses, whether it's a type of shelter or something else, so that they can maintain a good standing with their probation and meet all of those, kind of guidelines. But no, we do not capture which folks have been previously incarcerated. And we have in past years done work around counting folks who, if folks are in an institution, for example, if someone is in jail, but they've only been in jail for like a week, for example, and they were homeless prior to going into jail and will be homeless after, looking at counting that. This year, we did not count individuals who were currently incarcerated in jail that were homeless and exiting into homelessness. When you do that, there has to be less than 90 days in jail. We did not do that this year.
And then the next question, how do the youth figures correlate with figures from Ben Lapine, McKinney-Vento on house students numbers?
I don't mind taking that one.
Yeah.
So we do have in our presentation from last year how these figures correlated. The last update that I have, or that I can find from McKinney-Vento Unhoused, is from 2023. So we didn't include it this year because the numbers were 3 years old. And so that might be being published, sort of after this was created. And that is certainly something, again, that we've talked about as a group, posting on the website as well, but not at the time of this presentation.
I am hopeful, though, that will get better because our local representative just helped McKinney-Vento get codified into state law. So we're the first state in the nation to do that. That kind of adds extra protections for unhoused students. So hopefully that will improve the data and getting the data. Also, McKinney-Vento, they capture data on folks who are like doubled up or couch surfing. And so for HUD, that is not a data set that counts. We have in the past, as Autumn said, captured both data sets and kind of compared them at the local level to share that with you guys if there are folks doubled up.
And then regarding the number of chronically homeless and its definition, the number seems low. What is your assessment of the accuracy? And thank you.
I think that it all has to do with how people identify themselves. So it likely is probably low if folks don't understand, the different questions and how we get that number. We have seen over the past several years folks aging in place. As we said, folks who are getting older and they have more needs. And so I don't know if you, Autumn, have more you want to share on that for the data. That's just what we have as far as what people provide us with.
Yeah, because it's self-report, we find that challenging to kind of corroborate with the accuracy against what we think. So I don't ever like to make assumptions about that. What I do know is that we have, permanent supportive housing projects that require folks to be experiencing chronic homelessness based on that HUD definition to access the program. And that is a verified process. So when we're talking about permanent supportive housing projects coming online, over the last year or two, such as Cleveland Commons, we have family permanent supportive housing, youth permanent supportive housing projects, and veteran permanent supportive housing projects, as well as some scattered site as well. Those are indicative of having a community of folks experiencing or aging into chronicity, as Eliza has mentioned.
Yeah, so it may be that just the reduction is because we've brought a lot of housing options online for those folks. I think it's important to note that youth have a different chronic definition than adults do. And so there may be some discrepancy in that number due to the fact that youth homelessness is a little different.
Yeah, and just tacking onto that, something that when you mentioned that, people who are experiencing chronic homelessness can also find access to rapid rehousing and long-term rental assistance programs. So while they're not necessarily a requirement of those programs, folks who are experiencing chronic homelessness can certainly access that. So with that drop in our count from this year over last year and all of those new projects coming online and housing folks, I do think that because we are working as a continuum to work with those who, are experiencing the most critical situations, that those folks are getting into the programs that are available.
Yeah, they are prioritized.
And then we have a question, are individuals in permanent supportive housing like Cleveland Commons counted in the PIT?
They are not. Permanent supportive housing it does not maintain a homeless status, meaning that once folks are housed in a PSH project, they are no longer considered homeless. So the count is for sheltered transitional housing, not permanent supportive housing, and unsheltered.
Mm-hmm. And we have really very few transitional supportive housing. So those folks getting into Cleveland Commons and other housing options are really, helping with reducing those numbers and stabilizing those folks.
And then do either of you have any idea how Central Oregon counts compared to the state?
I don't yet. The data was due to HUD on April 30th, which was not very long ago. So I don't have state data yet. Uncertain when we're going to see that at the state level. I don't know, Eliza, if you have any indicators.
No, I know that the report to Congress as a whole usually doesn't get to them until December, and that will, kind of encompass everything. I think it'll be interesting for us we can ask OHCS that and see if they're going to be compiling it. I'm sure that they will be because of all the funding to, they really targeted those areas in the state that had the highest numbers. And so Central Oregon being one of them. And so I'm sure that they will be waiting to look at like the reduction and, how those resources are working.
I also would highlight that the COCs are only required to do a PIT count once or every 2 years. And there are some regions in Oregon, some COCs that chose not to do a PIT count due to the very confusing and lengthy NOFO that almost was released around the same time. And so some of the COCs across across Oregon just chose to not do a PIT count this year to be able to focus on the NOFO.
Is that all the questions?
That is all the questions.
Okay. Well, thank you all so much for, joining today. The recording for this, as well as the slides, will be on the website. So if folks missed this meeting today, you can forward it to them or share that with them. For more information or ways to get involved, please visit our website at cohomeless.org. And yeah, thank you for attending.
Thanks all.